Hello, my name is Eben De Matteo. I'm the physician assistant with Dr. Frank Noyes. On behalf of our team here at Cincinnati Sports Medicine, I'd like to welcome you to our Total Knee Replacement Educational Series. In this video, we'll be discussing the intraoperative or inpatient phase of a total knee replacement.
You'll be given an arrival time for your procedure at your preoperative visit in our office. Once you arrive at Jewish Hospital on your surgery day, you're going to meet many members of our team who are going to get you ready for the procedure itself. This includes starting IVs, going over your past medical history, your allergies, medications you'll be taking, and you'll also meet with the anesthesiologist who will be going over the medications that they will be using, such as those to control your nausea and your pain. Once we're ready to begin your procedure, you'll be wheeled back to the operating room where you'll meet additional members of our staff. Your family at that time may be able to wait in the waiting room at Jewish Hospital. However, Jewish Hospital is currently following all CDC guidelines for COVID-19, so space may be limited. After the procedure is complete, you'll be taken to the recovery room. There's a nurse that'll be designated for you who will be able to provide all the post-operative care to make you as comfortable as possible. They're always in constant communication with our team, and a member of our team will be around frequently to check on your status. You will actually work with physical therapy while in the recovery room, and if it's been determined that you'll be admitted overnight, you'll be taken to a room once it's available.
Some of the dressings we place on you after surgery may be waterproof, allowing for limited showers. The nursing staff at the hospital will change your dressing when necessary. The dietary staff will also be around to assist you in meal selection during your admission. Physical therapy will begin working with you the day of or the day after surgery. You'll be weight bearing immediately and begin a program with them to increase your strength and range of motion. If you purchase an ice machine, you should bring it with you to the hospital as they're very effective in reducing pain and swelling. Labs may be obtained during your admission. This is to ensure that you're recovering appropriately. Our nursing staff at Jewish Hospital will also be around frequently to obtain vitals and assist you with any needs that you may have, including addressing pain or nausea.
Controlling your pain and keeping you comfortable is very important to us. There's a number of different medications and modalities we utilize to accomplish this. Before the procedure itself, you'll discuss with anesthesia about the medications that they'll be utilizing. Dr. Noyes will actually put a local block in around your knee during the procedure, and either before or after the procedure, it's likely that anesthesia will be placing a nerve block that lasts about 24 to 48 hours. For the next 3 to 4 weeks after surgery, you'll likely be utilizing oral pain medications such as narcotics to make you comfortable during the recovery process. Now, while we cannot alleviate your pain entirely, our goal is to bring it down to a tolerable level. It's important that you keep in close communication with us as we only write pain medications on a week-by-week basis, and not all pain medications affect everyone the same. So please let us know if you feel that your pain is not adequately being controlled or if you're experiencing any adverse side effects. If you're admitted in the hospital overnight after surgery, there are several labs that we do keep an eye on. We keep track of your blood levels to make sure that you don't have too much blood loss, but another lab that we do keep track of is blood sugar, and this is because if blood sugar gets too high, it does increase risk of infection. We may need to give you medications to bring blood sugar down, but this does not mean that you are diabetic. We're simply creating the most optimal circumstances for your body to heal and recover.
After surgery, patients are at an increased risk for blood clots, which can be life-threatening. There's many modalities we utilize to mitigate this risk, such as those listed. You also may be on blood thinners, which do have side effects, including increased risks of bleeding, bruising, and upset stomach.
One of the most common complications after surgery are respiratory issues. This is easily mitigated by using a device called an incentive spirometer. This device encourages deep breathing and expands the lung tissues to help clear out excess fluid.
After surgery, you're at an increased fall risk due to such things as muscle weakness. So be sure that when you're getting up, you ask for assistance from one of our staff members. Make sure that you're utilizing socks with rubber grips on the bottom to avoid slipping. And when you're getting up to walk, make sure that you're utilizing your walker or other assistive device.
After the day of surgery, you'll be working with physical therapy pretty much immediately. You'll be having therapy visits about twice a week, during which time you'll work on increasing your strength and range of motion. In the first 3 weeks, range of motion is the most important thing to focus on. We need you to be able to get your leg not only completely straight, but be able to bend it to about 90 degrees. Your therapist will help develop a home exercise program, and it's important that you listen to the instructions and conduct all the exercises as instructed. There's also a number of restrictions that may be placed, and these are to help avoid injury and complication after surgery.
Thank you for taking the time to watch this video. Please be sure to ask us any questions you may have so that we can be sure to make your knee replacement a smooth and enjoyable experience.